Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. Happy TGIF Friday here in South Florida and beyond. Globally on the iHeartRadio app and on All County Healthcare's Facebook Live page. You can always go there to get a older version of the show, maybe something in the library. We had a doctor on that mentioned a certain procedure or treatment. You can look it up in the library or allcountyhealthcare.com. So thank you for sponsoring the show, All County Healthcare. We'll talk a little bit more about them later. They are a Medicare certified home health care agency in Palm Beach, Broward, and Miami-Dade counties. So big shout out to them. Thank you so much for sponsoring the program. We have a really great program tonight because we're going to be talking about integrative medicine, something I didn't know much about a week ago, but I've done a little bit of research, and I was it was a little surprising to find out we have a lot of integrative medicine doctors in the area, but I don't know if we have one with more expertise or more training than Dr. Brian Jakes that we're having on the program tonight. So without further ado, Dr. Jakes, welcome to the program. How are you doing today?
Thank you. Very good.
Thank you for joining us on this adventure of health. So like I said, integrative medicine, a week ago, I didn't even know what it is, but I did some research on you. You got a great website, and we'll give that out in a second. But you're actually board certified, so you're certified in integrative medicine. So tell us a little bit about, I guess in layman's terms, but what is integrative medicine, and a little bit about, I guess you're board certified in it as well. So that's really important, the board certification.
Yes, I'll explain what integrative medicine is first. Basically, it's the combination of conventional medicine, something like internal medicine, in combination with different treatment modalities, which would be considered alternative complementary. And they could house a number of things, acupuncture, chiropractic, homeopathy, naturopathy. So it's really a kind of an umbrella term.
Okay. So it's more of in-office treatments. I kind of I'm getting a feel of integrative medicine is mostly done in the office over a certain amount of visits. Am I correct with that? That you actually do in your practice?
Right. It's different in the way conventional medicine is practiced. Okay. Number one, it's patient-centered instead of physician-centered.
Oh, okay.
Okay. So the patient,
Nice.
It's more of a collaborative effort with the patient in trying to reach their goals. And there are certain things that drugs do very well that supplements can't. And there's certain things that supplements do very well that drugs can't. And it's how to combine them properly to get the most effective use.
Okay, and then under medical care as well. So you have the certification, board certification. I mean, that's not something that I know there's some doctors that practice without it, but that's very important when, searching for a doctor because you're up to date on the latest in that medical specialty, correct?
Yes.
Okay, because you have to stay board certified.
Right.
You have to take tests and exams. And, it's not easy, right?
30 continuing medical credit hours a year.
Yeah, we talked about that recently, CMEs. We had a doctor talking about a symposium he was going to get more CMEs. So that's really neat how you're staying up on that. And I think that's the expert that, you need in healthcare. So integrative medicine, what common chronic diseases and conditions can it help with?
I end up treating it quite a bit. It's a variety. Usually, there's a reason what brings people in initially, either chronic fatigue, hormonal problems, hypothyroidism, diabetes, prediabetes. And actually, I've seen quite a large bit of autoimmune conditions. They seem to be kind of gaining in common diagnosis.
Okay, and what exactly are autoimmune diseases?
Basically, when your body's immune system attacks your own.
No, yeah, that's not a good thing, huh? Definitely. So you treat that as well, and we hear a lot about the thyroid in the last few years. I mean, I had a family member who had thyroid cancer, and luckily, I guess it was taken out, and She's on a medication, and it's very monitored. I'm sure the listeners can attest to that. Family members, we've heard a lot about thyroid and, of course, diabetes. I mean, it's really growing in this country. I mean, you can attest to that as well. So that's a little bit about the common chronic diseases and conditions. Another thing I saw on your website, and I want to give it out now, it's radiantaesthetic.com, and I'll give it out again during the program. Dr. Jakes is in Delray Beach. He has an office there. Is bioidentical hormone replacement. Not sure I've came across that one before. How is that effective?
Well, again, as we get older, the ability to produce hormones, a variety of hormones in the body, decreases. And the most common ones for men are testosterone and then estrogen for women.
Okay.
And the difference with bioidentical is that it comes from a natural source and then converted into a molecular similar hormone that's in your body. So it's identical in that nature as compared to synthetic medication, which is slightly different. To be a prescription drug, it has to be chemically different.
I see.
So that's one of the problems.
Okay. And if someone has has some of the signs and symptoms, maybe they think that they don't have enough testosterone or estrogen, they come to you, and do you do the testing with them?
Yes.
Oh, nice.
We do very extensive laboratory testing. It's shocking to some of the patients and even shocking to some of the lab techs that draw the blood because the number of tests, because to do proper treatment, we need to encompass the whole patient, not just one little area. Mm-hmm. So we have to do kind of a wide range of testing.
And for men, what ages are we talking about that kind of that testosterone drops off? Is that like kind of the middle-age thing, or can it be at different times in life?
Yes, it can be. Usually we see this predominantly in the 50s.
Okay.
But I've had patients as young in their 20s.
Oh, wow.
That's unusual. But
it's early. 40s? Just turned 40. Maybe?
Generally there's a decrease after, the peak is in the early 20s, and then generally supposed to be a decrease of like 1% a year.
Uh-huh. I know we could do a whole show just on that, I imagine. Can you give us a little bit about what signs and symptoms someone would have if they didn't have enough testosterone and it was time to see a doctor about it?
Yeah, usually most men come in, they feel exhausted, fatigued, weight gain, and then decreased libido.
Okay. What about women? What kind of ages does the estrogen, there's not enough estrogen, I guess, in the system?
Yeah, we see them usually, everybody's different when they go through menopause.
Of course.
And, again, typically in the 50s, it's usually...
Okay. And again, they can call your office, make an appointment, and you can work with them to see if they have the signs and symptoms?
Yes, it's always, again, it's based on a combination of both, their symptoms and also laboratory results.
Okay, since I said the call number, I'm going to give out Dr. Jake's number, 561-501-4482. Dr. Brian P. Jakes, Jr., Radiant Aesthetic, 190 Congress Park Drive, Suite 180, Delray Beach, right around the corner here. If you are in the area or you want to check out online, radiantaesthetic.com. Another reason I really wanted to have you on the program is platelet-rich plasma injections. I always get it wrong, PRP. Tell us what that is and how it can help the body, because that's something that sounds really neat.
Yeah, it's really it's a phenomenal way to treat injury, especially, and also help with regeneration of different parts of the body. It can be used virtually in every area, from joints, skin, hair. So any place that has damage or wear or insufficiency can be treated by it.
So hair loss?
Yes,
for men?
Yes, absolutely.
Huh. I'm looking at my picture here. I've definitely come across that in the last few years. Freddie, our producer, could probably use some platelet-rich plasma injections as well as I could too. But no, to be honest, not to make it a funny thing, but like a Weekend Warrior kind of overdoes on the weekend, has some joint issues, pain in the joints. Maybe they could come see you, and is there I guess it's taken out of the body and spun in a centrifuge right in the office?
Right, yes. we draw blood and centrifuge it actually a couple times and concentrate the platelets, and also there's growth factors with that as well, and then inject it back in to the area that we're treating.
Right there, same office visit?
Yeah, same time, same visit.
How long does that take normally?
Depends what we're doing. Usually, like we're doing a joint, a knee, or a shoulder, usually 45 minutes.
Wow, I can't believe that's done the same office visit in 45 minutes. That is unbelievable. The way medicine's moving. What are you, for platelet-rich plasma injections, PRP, what are you doing the most of? What do you see the most of the need for it in your office, in your practice?
It varies. I mean, the joints, of course. Knees are usually one of the biggest things.
Yeah.
And then a facial. You can use it for regenerating collagen in the face.
To get that composition back in the face?
Yeah, so people that don't want fillers or Botox, it's a great alternative because it's natural. It's your own blood. And so there's no rejection, no chance of, virtually no chance of any complication.
And you do it yourself as the doctor because you're board certified?
Yes,
that's nice to hear because we've heard stories different around the state, down south. I mean, there's been a lot done without board certified doctors, and there's been a couple really bad cases. I'm sure you read about them, but you're an actual doctor who's board certified in integrative medicine, so that makes me feel more comfortable, and the listeners, I imagine. If listeners, if you have any questions, we have Dr. Jakes here till 6 o'clock. 1-888-565-1470. We got about 2 minutes until the break. I want to get into one last topic about PRP. Is it being done correctly around Florida? Because I know there's a couple other doctors doing it, and can there be a right way of doing it in the office and maybe not so much? Yeah,
since there is no standard, it's really based on what system you use to process the PRP. And a lot of the systems out there, most common ones out there, are really not harvesting the proper concentration. To make PRP, it's platelet-rich plasma. To make that have a certain concentration of platelets. And if you don't reach that, then the result's going to be subtherapeutic. It's not going to work.
Okay.
So that.
How long have you been doing PRP?
About 7 years.
7 years. Did you have to do a lot of additional training or studying on that to do that kind of?
Yeah, there was, of course, there's courses, and then also followed up with, one thing I wanted to express
definitely. Go
in the
ahead.
whole thing, even with all the treatments that are done, in integrative medicine, I know people have a lot of concern about, about the effectiveness and with it. All of the treatments that have done are based on clinical evidence, They have been studied, they have, again, been published in peer-reviewed journals, and when somebody says, hey, there's no studies on that, on like these supplements or on using these things, nothing could be farther from the truth, because I sat there and read them. And this is, I started, 25 years ago, before there was the advent of the internet, And so...
I remember that too.
Yeah, so you had to actually go to a medical library and pull the studies and read it. And so it was... They are there, There are every year millions of studies are done around the world, and they're, again, thousands, tens of thousands are done using on supplements, enzymes, hormones, and they work. And they work because you follow proper methodology, and that's where the failure is in a lot of treatments, that you don't follow the methodology that was used in the studies that were successful.
Is not having the education, the training, and, like you said, clinical research background, and reading your peers' peer reviews. Journals. Yeah, definitely. Wow, that's important. Well, let's take a quick break. We're really going fast here in integrative medicine. On the other side, let's talk about a little bit about anti-aging medicines and IV therapies on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today, All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. Hey, South Florida, we're back, and we're here with Dr. Brian P. Jakes Jr., Radiant Aesthetic. He's a board-certified integrative medicine specialist right around the corner here in Delray Beach with Radiant Aesthetic, radiantaesthetic.com. If you want to type it in, look a little more on Dr. Jakes and his background. There's a really good bio there on the website. Dr. Jakes, one other topic I want to talk to you about, because I'm sure the population here would really like to know a little bit about this, is anti-aging medicines, because we're all about going to the beach in South Florida and, you know, the nightlife. And tell us a little bit about how maybe we can slow down Father Time.
All right, there's really a measurable way to determine aging, okay, through what's called telomeres. They are at the end of the chromosomes of every cell. And as we get older, these telomeres shorten, and it basically tells us how long the lifespan of a cell is. And there are certain things that shorten our telomeres and certain things that lengthen our telomeres. So actually, we can slow or reverse aging to some extent and expand the lifespan of the cell.
Okay. Yeah, definitely. These telomeres, you're able to see them as a doctor with tests and whatnot?
Special testing, yes. Special testing.
Wow.
We can.
I didn't know that.
Yeah, we can determine their length compared to, usually when we're born, in the first few years of life, they're at their greatest length. And they maintain, and as we get older, as the cell divides, it loses a little bit every single time. So the telomere gets shorter and shorter and shorter to where it can't properly divide, and then you have cell death.
Wow.
So,
I didn't know that existed. Wow.
Yeah,
That's really neat to hear.
Yeah, so we can measure it, and now there are, again, clinical evidence through studies that we can take certain supplements, enzymes, peptides, hormones, that can actually lengthen the cell, lengthen the telomere on the cell.
Really neat. Is that taken from a blood draw in the office, and
Yes.
you're able to see our actual chromosomes?
Yeah, just able to get a reference.
Really neat.
So the treatment would involve, again, we can assess it and then begin different types of therapy. Again, like I said, the first thing is restoring hormone levels.
Mm-hmm.
As we get older, again, everybody's different, how their predisposition is. But again, like I said, testosterone, estrogen, decrease. Thyroid hormone decreases. Adrenal hormones decrease. So addressing those and restoring those to their optimum level is kind of the first thing. And then we can go after certain supplements. And there's one thing that works very best. The best is called growth hormone, an injection of growth hormone. Unfortunately, it's highly regulated right now. And so we use a version, it's a precursor of growth hormone called Somorlin. And that stimulates our body to produce our own growth hormone again. So we can restore growth hormone levels to where they were ideally back into the 20s and the 30s.
Nice. That's good news to hear in South Florida, definitely. How often do patients see you for anti-aging or PRP and Gen, those kind of things? Is it like a quarterly? Is it like, how does it work within your practice?
The first thing is to diagnose and then to start treating. And then as soon as the levels are restored by checking labs, initially it's within the first month or so, and then as we get everything back to optimal range, then the time we see them expands out to several months. And
I have to ask this because I know they'll ask me.
okay.
Do you take insurance for this type of medicine, integrative medicine?
No, unfortunately, yeah.
Okay.
No, we don't take insurance.
That can be okay too. We had a direct primary care of Boca Raton here, and she runs a practice. She doesn't charge insurance, so she's membership based, a little different, but I'm sure that people have heard that model. Well, they heard her on the show, but tell us. You don't take insurance, but there's you have a plans. You work with people with plans, or that kind of thing, or
no? Actually, really, what's the most expensive part of the treatment generally are the laboratory tests, and usually, so we can run those on the patient's insurance.
Okay.
That's
nice.
typically the most expensive part generally.
Huh, I wouldn't have thought of that. Good to know. That's why we're bringing you on the show, to learn a little bit more about each type of medical specialty on the How to Stay Healthy show. Now, IV therapies, I've seen this almost in like a boutique setting lately. Is that for real? And you're doing it, you're an MD, so you're doing it in your office. You're an MD, right? Okay.
I'm an ND.
ND, okay, that's right. But you're doing it in your office, the IV therapies, and
yes.
you have the certification in integrative medicine to do this kind of therapy. But what are people using IV therapies? Because I've seen it more in a boutique setting, like I said, for like hangovers and stuff. I'm sure you've seen that.
Yes, I've seen it. It's used. It works. Try to use it for more practical purposes for disease treatment. Okay, but there's nothing wrong with doing one, typically what's called a Myers cocktail, and they help in several ways. With fatigue, immune system stimulating effects.
Okay, and now, how long does an IV therapy typically take in an office setting?
Usually about 30 to 45 minutes.
Oh wow! So it's almost same as the PRP. I mean, that's under an hour. I have a heart that's amazing to me that because I have some primary care visits that have been longer than that, and we haven't done any kind of injections. I didn't feel better after them, to be honest with you. Maybe this was the news I was getting in the primary care meeting, but no, but that's really amazing. Now, tell me a little bit about your education and training. We always like to hear, where people went to school and how and where they learned. So, can you tell us a little bit about that?
Yeah, I've gone to several different schools actually over the years. The medical school was actually in Windsor University on the island of St. Kitts.
Nice.
Yeah,
that must have been neat. But there's a lot of medical schools in the Caribbean and islands, I've noticed.
Yeah, there was like 5 medical schools on just that one island alone. Yeah, so it's yeah.
Unbelievable. So were there people studying from all over the world, or was it just mostly U.S. and Canada?
No, all over the world. I've had patients. Yeah, students from
neat.
from far as India, Africa. It was.
You still have friends today, peers, that you met in medical school?
Yeah, I tried to keep in touch with them.
Nice. And why did you decide to go down there?
Just the time of the program. It was it was an accelerated program.
Nice.
So
now, are you originally from South Florida or?
No, originally Buffalo, New York.
Oh wow. You got sick of the snow?
Yeah, I had enough of it. It was.
I read a lot about Erie, Pennsylvania, and Buffalo, New York, and I grew up down here. I always say, I'd love to live up where it snows a lot, but everyone tells me you wouldn't want to go through that every year. Buffalo's got the last 5 years have gotten some heavy snowstorms. Now, did I read too that you have emergency room training? You worked in an emergency room?
Yeah, I did. I did time training in an emergency room.
Like as a resident?
Yeah.
Oh wow, where was that at? In the U.S. or in the islands?
In both. I
okay.
did in Louisiana, and then also
nice.
And then also down there in St. Kitts.
I love Louisiana. I just the listeners know I took a trip last year. I drove from here to New Orleans and back. It was fantastic. I love New Orleans and I can't think of the name of that. Lafayette, Louisiana.
Oh, okay.
Really nice. So that's really neat too. Where are you originally from?
Buffalo.
Oh, Buffalo. Yeah, that's right. I asked that earlier. For some reason, I had a doctor from Toronto on a few weeks ago, and I was getting them mixed up. That's why. So, what are your hobbies and passions in life outside of medicine when you're not doing integrative medicine? You look like you're in pretty good shape. I imagine you work out and practice what you preach on being healthy.
Yes, it's very important. Trying to keep up with everything. Again, between medically, study-wise, it's time consuming. I try to stay on top of everything.
Definitely, and running your own practice, that is that can be time consuming as well.
Yeah,
right?
I'm not running it. I'm part of.
Okay.
I'm one of many doctors there.
But a partner, even.
Yeah.
I mean, in the practice. What other kinds of care do you provide at Radiant Aesthetic? What other kind of doctors are on staff there?
Plastic surgeon.
Oh, nice.
And so that offer those. Also, we do have somebody who comes and does fillers and Botox.
Okay.
Well. And then aesthetics as well, esthetician. And so they have facials and dermabrasion.
What age range of patients do you see?
From again anywhere from the 20s, to the 80s, honestly.
So adult, yeah, definitely. That's really neat. What brought you to South Florida?
Besides the weather, no. This is one of the highest concentrations that utilize these types of treatments. Mm-hmm. So
yeah, I tell you what, you look like a South Floridian. You've been here a little while. You get to the beach
years.
and whatnot. Yeah, neat. I do too, believe it or not. I'm originally from Jupiter, so I love it. I live in Boynton today and got a radio show in Boca, and there's no place I'd rather be in. I just want to say thank you again for coming on the show. We've had so many doctors from different specialties in the last 2 years, and we're becoming known as the place for health news because of doctors like you that take the time to sit down and talk to us about integrative medicine. I didn't even know what it was a week ago when you called me. So thank you. And thank you, Dr. Baker, for sending you over. That's awesome that we're getting another doctor sending you over. But again, Dr. Brian P. Jakes Jr., 561-501-4482, radiantaesthetic.com. Thank you.
Thank you.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.